Welcome to my channel, Shaka Lifestyle TV. Please subscribe, like, share, and click the notification bell. Welcome to your daily prescription of knowledge. There may be a sexually transmitted disease that you have and don't know. Because this bacteria is mostly asymptomatic, most people may have it and pass it on unknowingly to others. No, this is not a new sexually transmitted disease. Actually, it was discovered in the 1980s. So it is much younger than the gonorrhea, the chlamydia, and the syphilis. So we could call it a Gen Z sexually transmitted disease. And the name is Mycoplasma genitalium. Mycoplasma genitalium, right? This bacteria can be obtained from your cervix because it can give you cervicitis. Your urethra, because it can give you urethritis, and your rectum. Now, I'm going to elaborate on this. I've been a nurse for a long time, and I discovered this during my nurse practitioner, women's health and OBGYN rotation. And I'm going to tell you, I was blown away because me, I am very, very religious when it comes to my OBGYN checkup and my annual physical. And my doctors has never, because I always have a lab result to go home with, my doctor has never checked me for Mycoplasma genitalium. Never. When I discovered this, I went to work and I work with like 250 people. I have yet to meet one nurse that said, yes, I know about it. And these are seasoned nurses, some of them since 1974. They're like, what is Mycoplasma genitalium? I said, it's a sexually transmitted disease. They're like, what? I said, yep. And these can cause complication. And when they cause complication, that is when they become symptomatic because you can have vaginal and penile discharge, right? It can lead to pelvic inflammatory disease. It can lead to ectopic pregnancy. Um, yes, pelvic inflammatory disease, and it can lead to infertility. So, guys, usually when you go to your doctor, because I mean, you don't have to, lay down and let them swab your cervix unless you go to your GYN. But usually when I go to my doctor for an annual, my doctor asks for a urine sample, and they usually test for the gonorrhea, the chlamydia. They will check for your kidney function. They're looking at your GFR, your creatinine. They're looking for red blood cell, white blood cell. They're looking for protein in the urine. They're looking for glucose in your urine. They're looking for nitrate, UTI, you name it. But I'm telling you, I've had friends. They never check them for the sexually transmitted disease. I know that some of you may know about it, but there are people out there that do not know. Like myself, I discovered this recently when I was doing my nurse practitioner rotation. I am telling you, people, my co-workers, my friends, they did not know, and I have all healthcare workers friends. They did not know about Mycoplasma genitalium. And now that I'm in a clinic, I'm seeing a lot of males and females that are positive with it and they don't know. When the lab result come back and I'm like, okay, we're in the room privacy. I'm like, okay, so you have a STI. They're like, what? I'm like, yes, you have a STI. They're like, how did I catch that? I'm like, I don't know. The females will be like, what? I'm like, yes. They even went so far. And I'll tell them because they never hear of this name. And I'll tell them, okay, Google it because they don't believe me. I say, Google it. And they Google it. I put them on credible website like Mayo Clinic, Cleveland Clinic, CDC. I said, look it up. They're like, there gotta be some other way that I catch this. I said, no, it's sexually transmitted. No, I am not here to judge you. I'm here to identify, treat, and educate you. We will give you two antibiotics. This disease is bad because you are treated with two antibiotics. We can treat with Zitromax, and then after the Zitromax, we do doxycycline. Now, CDC has put out a report that the Zitromax are becoming resistant to this Mycoplasma genitalium, the bacteria that cause it. So now they're like, okay, you can use moxifloxacin along with doxycycline, right? So, guys, believe me, when you are infected, when you have this STI, your partner must be treated. So, I am not here to judge. I am only here to identify, treat, and educate. When you are positive with this, your partner must be treated. Now, after treatment, we give you a test of cure. A test of cure, you return to the clinic in 3 weeks, and we collect another urine sample and we send it to the lab to find out if you still have the bacteria. Now, when we give you the medication, we teach you to not to have sex, but if you choose to have sex, you must use protection like a condom. So, once again, if you have it, you have to tell your partner because you're just going to be reinfected. I treat you, I don't tell you, it's just going to be a cycle that doesn't stop. And as I said, for female, it can give you pelvic inflammatory disease, and it can lead to infertility. So, guys, the next time you visit your doctor, please just provide a urine sample. Tell them, I want a urine sample because I want to know what is Mycoplasma genitalium. You may just be surprised. Once again, like, share, follow, subscribe. Thank you.